You're watching NBC San Diego News.
Hospitals overwhelmed by a pediatric mental health crisis. Families struggling to cope with the devastating impact.
Thanks for joining us. I'm Monica Dean. In the next hour, we'll be taking an up-close look at kids in crisis, the mental health of our youth, the staggering number of children and families who are struggling. And for the first time ever, we're getting an exclusive look inside Rady Children's Hospital's psychiatric emergency unit, where doctors are trying to meet an overwhelming need. According to the CDC, 1 in 5 children have a diagnosed mental health disorder, but only about 20% are getting treatment. And that's why learning to spot the warning signs is so critical. As part of this special, we want to provide you with tips and solutions to help you better care for the kids in your life. Here's licensed clinical psychologist Azmaira with what to look for if you suspect a child might be in crisis.
If you're concerned about your teenager struggling with some mental health challenges, you want to look for changes, subtle, moderate, and severe. Changes in sleep, changes in eating, changes in social behavior, changes in academic, changes in any kind of daily life routines that might flag you that something's not quite right.
Spotting the warning signs of a child in crisis can be challenging, but if you recognize something isn't right, knowing how to respond is critically important.
If you identify areas of concern or even a crisis, you should begin the conversation with your child as soon as possible, because early intervention is prevention. And you do that by asking a few gentle questions and doing great listening. The more we can listen to our kids and teenagers, the more we can bridge the gap in communication. And you want to ask questions like, how are you sleeping? Are you eating well? Can we do something more around your nutrition? Do you want to see your friends more? Should we talk about your grades and how school is going? Just gentle questioning. If the child opens up, that's great. Then you continue the gentle questioning and continue to listen well. The next step would be, if the child is in school and has a school psychologist or school counselors, is to set up a meeting with them and let them do an initial assessment. And if it's a more severe situation, moderate to severe situation, and you need a more urgent eval, you should go to what's called an urgent behavioral health unit. A lot of hospitals during COVID have opened them up for these reasons, and you can do walk-ins or you can make an urgent appointment. And if it's a crisis, you pick up the phone. You pick up the phone, you can call 911, and you ask for the psychiatry emergency response team for children and teenagers. And you can also drive to the nearest emergency room. Don't wait.
Setting boundaries for social media is a conversation clinicians say every parent should be having with their child. Psychologist Azmaira has some tips on how to have that talk and what should be discussed.
I think parents and kids should educate themselves about the impact of social media. So the first thing we need to do is learn about it for ourselves. There's tons of research articles out there, tons of links out there and you want the child to participate so that they learn about it and can be informed consumers. After that, it's a negotiation. If you force children to do things, don't worry, they'll sneak out and do it behind your back. So it's better if it's open communication, there's collaboration, there's communication, and you come up with systems that work for the kid and the family simultaneously. Otherwise, there's going to be a power struggle constantly. And you come up with a system that's going to be reinforcing and rewarding for both. But you can't just take away social media. You have to replace it with something better, something more fun, more engaging, more productive, but more fun for the child. If it's not fun, they're not going to do it instead.
As we know, stress is one of the leading factors contributing to sickness, disease, and mental health. Stress is a natural human response, and everyone experiences it differently. It can lead to anxiety or depression, especially for someone struggling with mental health. Clinical psychologist Azmaira has some tips for young people on how to manage stress.
In order to cope and manage stress, we want to ask ourselves, how are we stressing our children out? What are the pressures we are placing on our kids? How much can kids and teenagers cope with? What do we need to do to reduce the stressors? Is there pressure on grades and academic performance, getting into colleges, sports and athletic performance, social performance, extracurricular performance? Are kids getting enough sleep? Are kids eating 3 to 4 balanced, nutritious meals a day, right? Are they having enough fun? Are they enjoying their lives? Are they feeling joyful and happy? If we can reduce the stresses, our kids will cope better. So every family needs to ask themselves and ask the kids, what are the major stresses for you? And how can we balance your life out better so you're living a balanced, healthy, joyful, productive life? So whether it's reduction in homework, maybe they don't go to all the sports practices, providing healthy, nutritious meals, making sure they're going to bed on time and getting a good night's sleep. There are many, many things that we can do, adults, in a practical way to reduce stresses based on the child's unique needs in that moment.
Doctors and clinicians say it's important to normalize the conversation about mental health and to give kids tools to help before a situation escalates. And they say no matter the age of the child, the time to start having that conversation is now.
The best time to talk about these struggles or challenges is as soon as possible. It could be a child as young as 2 or 3. You can get on the floor and play with them and ask, are you happy? Are you sad? These are very simple questions that will give us feedback from the toddler. That's okay. With the older child, you can have a simpler conversation as well by just asking them, are you happy? What's making you happy? What's making you sad? Are there some challenges that you might be struggling with that we should talk about and think about how to support you better on? So as soon as possible, again, early intervention is prevention. In terms of how to have these conversations, listen. Keep it simple. It shouldn't be more than 10, 15 minutes at a time. Little snippets are okay, unless the child is sharing, and then you just sit back and listen. Don't overwhelm the child. And talk about it in a language of wellness. We want to support you. We want you to feel joy. We want you to feel productive. We want you to live a balanced life. We want you to be healthy. We don't have to use heavy terms of depression, anxiety, eating disorders, substance abuse. We can use a lighter language that's leading the child to health and wellness and balance.
If you or someone you know is thinking about suicide, there is help. Call the National Suicide Prevention Lifeline at 988 for free confidential support. Their website, 988lifeline.org, also has an extensive list of resources. Thank you for watching this special report. I'm Monica Dean. Take care.